Good morning, everybody, and welcome to today's event with Qlife. Just some practical info before we start. I see the audience already posted lots of good questions, and you're more than welcome to post even more questions, and I will forward them to Kasper. With me today, I have Kasper Rosø, the CFO of Qlife. So with that said, I hope we will have a good event. Welcome, Kasper, and welcome to the audience.
Thank you very much, Claus, and welcome to the audience also from my side. I've been looking forward to presenting the interim Q2 report for Qlife for all of you, which is the topic of today. So I will dive right into it and move on to the first slide here, which is highlights from our income statement. And first of all, I want to note that now we have totally stopped, and we mentioned that also in our last report, that the SARS-CoV-2 test was stopped in Q1, so there is no revenue from that anymore. And we have, as you can see, there is 46,000 euros in revenue here, which is the first test systems that we have been shipping out of the CRP capsules and the Ego Q300 device also that we have launched as a wellness product now. Then apart from the launch and the early shipments of the CRP, we have been focusing on preparing the company for the next stage of our journey, which is restructuring and taking out all the infrastructure that we had built up to support our SaaS business. And you see cost related to that in our OPEX for Q2, since we have been exiting our long-term lease agreement for manufacturing facilities in Industriparken in Ballerup. That was at a size that does not fit our future operating model. So we were lucky to find a new tenant and to minimize our obligations in terms of that lease. So that puts us in a situation now where we have exited the lease and are down, and I think that will reduce our rent to approximately 10% of what it was before. And at the same time, we have concluded all the staff reductions that we have needed to do. So we now are in a lean setup that are ready to pursue the new opportunities within the CRP business and execute on the partner model that we will be operating there. So you see a continued reduction in the base OPEX, and that's when we clean out the termination cost and the effect of R&D activation of 10% compared to Q1. And we expect the full effect on the OPEX reductions to be in Q4 2023. The reason for that is that we enter into the new rent agreement on 1st of November, and a few of the staff reductions are effective end of June and end of July. So that's the reason for that. If you look at the distribution of our revenue, then you see that we have some in Sweden. That's and this is first half revenue and that's related to the SARS-CoV, while other countries, unspecified so far, is the revenue that we've had from the new CRP capsules. Then I will move on to the balance sheet. First of all, you can see that the intangible fixed assets has grown to 109,289,000 Swedish kroner, and driven by continued increase in capitalized R&D, and that is as we add features and to both primarily to the capsule and our collect and are looking at further iterations or improvement on that on top of the first production models. Then we have a decrease in the tangible fixed assets and long-term liabilities, and that's the termination of the long-term lease for the production facility. So you see there we go from 54, almost 55 million Swedish kronor to 8.3. That reflects that. And then you see the equity increase that is driven by the rights issue that we did in April. Then talking about cash flow, which obviously is a main concern for us also in these days. The cash flow from operations for Q2 was negative 11 million, and cash from changes in working capital negative 8.6 million, and cash flow from investing negative 6.2. Then we have 34 million positive cash flow from financing, and a total cash flow of positive 7.9 million, which gives us cash at the end of the period of 9.4 million Swedish kronor. And as I have noted in small here, that we had a rights issue of 57.7 million, but we had to repay bridge loans, and interest and leasing is going against that when we look at the financing, and that's why we end up with a 34 million from financing. And then just to go through our significant events, very important was in first half was the launch of our EcoCRP assay. This is the first proof that we have a product after COVID that can go out to users, and we are gaining feedback, early feedback from the first users as we speak here. Then we attended the AACC in California, Anaheim, where we launched what we call Ego Innovate, and that is one of the way that we will be partnering on the technology, which basically what that is, that we make the Ego system available as an open system for partners to operate their own assays on, and that will significantly lower the upfront investment that's required in order to get regulatory approvals, since the system is already operational at the required level and with the required approvals for that. And we got good interest in that. I know that we have gotten questions when we were going to announce outcomes of that, and I can say that the conversations we have following the Anaheim conference are all being done under NDA so far, and it takes a while in order to land a partnership agreement. So stay tuned. Something will happen. I cannot tell you when though. Then we did the rights issue in April of the 57.7 million. We already covered that when we talked about the cash flow. Then the agent arbitration, which relates to our distributor agreement with agent, has been on pause for the summer period. The good thing that has happened is that our counterclaim that relates to agents of 2.2 million euros that relates to agents' obligation to a minimum purchase amount during the agreement has been accepted. So we are hoping on a speedy recovery or resolution of this, of course, since we expect to be the main beneficiary of once this gets settled. So That's the status of that. Then the TO2 warrants was executed, and they were significant out of the money. So it's quite understandable that we only got a signing of 0.17%. So that was did not assist our financing, since the cost of the running the warrants was actually higher than the proceeds from that. Then during the summer, we have been working on with some of our investors on a convertible loan, since we were not confident, given where the stock price were, that the TO3 that runs in September here was gonna yield anything. We found it to be proper to prepare our cash reserves, so we could operate without any contribution from TO3. So that's why we have landed this convertible loan of 4.6 million Swedish kronor that gives us the cash needed for 2023. And that was sort of what I wanted to take you through in general here. So I will be happy to move on to the questions now, Claus.
Well, thanks a lot, Kasper, for your good presentation, and you answered some of the questions. There's actually a lot of questions today. That's really nice to see. So let's start with what you mentioned last first, about your long-term financing. If we look 1 year ahead, Kasper, both with the recent rights issue and the loan you secured, would that be sufficient with those plans you have now to finance the business?
We expect that we will at some point require further financing, yes. But for now, we have what we require, as I stated, what we require to operate for the entire 2023.
Good. And then, in respect of that, you lowered your cost base quite significantly. You launched this restructuring program last autumn, and you've been expanding that towards 2023, and position the business for the future. Can you elaborate a little, Kasper, on your expectations to future run rate? There's a couple of questions here from the audience in respect of the run rate.
In terms, when you say run rate,
on the cost side.
So I can say that we expect it to be significantly below what we have seen so far. It depends. So it depends on our ability to get financing, I would say, because there will be part that will be at some point we will have to build up some inventory, but that's not what we are doing right now. So and we aim to do that in collaboration with partners also. So I think it's Q3 will give an indication, but as I state here, Q4 will be even lower.
Q4 will be okay. Good. So can you just repeat how low did you actually, with the restructuring program last year, and your latest statement about the lease agreement, you have already now lowered your cost base. So what is the ballpark we're talking about, Kasper? Is it, could you elaborate a little on that just for the investors?
I would rather not disclose that number specifically. I cannot disclose the exact number, but I can say that I think you can see in the report we So I mentioned that we lower the rent to 10% of what it used to be then, and we have taken the headcount down to we are below 20 right and now, so it should be possible to do the math and get a pretty solid guess on that.
Good, Kasper. That's good. And then if we turn to the top line, because that's of course important. You mentioned this soft launch of your CRP assay earlier this year, and you've been mentioning before on our platform that right now you are targeting UK and Ireland. Is that what we see in other countries? Could you elaborate a little about how you work in the Irish and UK market with the rollout?
So what we're doing there, we are working with the distributors as partners there, and they have had sort of placed the first orders for the products. Then of course it takes a while for them to get comfortable with the product and start selling that. So that's there. So we are then assisting them, or will be assisting them in promoting the products.
Good. So part of these agreements you have with the partners, does that include building up inventory on their balance sheet, or do you do that in cooperation?
There will not be a significant inventory build up yet. That's not expected here. So for a start, it will be on our balance sheet, and it's limited until we start seeing traction on this. So we will not risk. We would rather be cautious here rather than risk be sitting with a huge inventory. We had to take quite significant write-downs on the SARS-CoV inventory because of agents' failure to meet their minimum requirements there. So in that sense, I think we want to be cautious. We are creating a new market here. We see trends in our favor, certainly. I mean, and that's worth mentioning also that the take back we had from looking at what was being offered from other exhibitors in California at the AACC. Home testing was clearly a trend, and we could also see that Qlife's offering was unique in the sense that it was the only offering that enabled monitoring of quantitative data. So there's a lot of devices that can do home tests of molecular assays that basically tells you whether a specific molecule is present or not. So for instance, a PCR test, but the delivering a number that you can monitor the level of something. We are the only ones that can do that, and that's what gained interest from the people we're talking to also. So it looks promising, I would say, but experience also has taught us that building a new market for something takes time.
Of course, Kasper. So what you're saying here, you soft launched your CRP assay. You see good traction in the market. It's early days still, but what the investors should expect is a 24 case more than a 23.
Yes, certainly. Yeah. That's what we are planning for. That's also the reason for taking in the financing. I think that also it's important that we can sort of have the right bargaining point when talking to the partners also. We cannot be forced into partnerships that are not good for the long-term value creation in the company either. And I think we are at a situation there where we can avoid that.
That's right. So And if we then talk about US, where you went to this AACC conference, you got good feedback. We actually wrote a good article about it a couple of days ago. That's even further out in the future. Is right to say so, that to see?
I would say it is quite interesting. So we went to a conference in the US, and the reason we went there is basically that is the probably and especially California. It's where all sort of new technology gets launched. What we learned there was basically we got attention not only from the US but actually from 4 different continents, I would say. So both from the US, from Asia, from Europe, and from South America also. So it was quite an international crowd. So and some of these things might be sooner rather than later, and that's the whole point of the Ego Innovate, that there with Ego Innovate we can actually start working and shipping today once we land an agreement, and there we will get revenues on devices, of course, but also on capsules. So it can, once we land the agreement, it could be fast, depending on the application that our partner is looking for. So if it's a new market, then they will have to build it, of course. But if it's something that's existing that they want to add it into, then it could be fast.
Good, Kasper. Thanks a lot. Then there's a good question from Max here in respect of the TO3. So if we assume a full subscription, and that of course depends on the share price, you could end up with around 69 million SEK. The only thing you have to do is actually to announce a partnership deal, and I know you would do that, and you could not disclose it if you're close to doing that. But should we expect something in the short term? And of course, Kasper, I know you don't want to violate the MRI rules, but could you elaborate a little on the TO3 and what we should expect?
I can, first of all, I cannot say anything about timing of announcements of partnerships, of course. If it was 100% sure that there was a partnership before, then it would already have been announced following the rules, because that would be significant and we would have to talk about it. I would be very happy if something gets announced before, and I think it would be very good for the shareholders if TO3 actually yields revenue or yields cash into the company, because that would put us in a very, very strong position going forward.
Could you elaborate a little on the terms just for the audience? So what is the terms for the TO3?
Though the TO3 is shares can be signed at 11 øre per share, and it runs in September. And right now, with the current share price of 0.4 of 4 øre, then we are a little out of the money, I must say.
Good. Thanks a lot, Kasper. Then there's a question here about, and you mentioned that before, about the CE marking of your products, and there's new requirements coming up, and that's why you chose to soft launch into the healthiness segment. When will you start this process? Could you elaborate a little on the time frame?
It is in process, I would say. So a CE mark requires different things. First of all, we need to do some clinical trials, and we mentioned in our Q2 report that we have started a collaboration with the Nordsjællands Hospital, and that's one expression also of our partner strategy. So actually, rather than having to do everything ourselves and pay for the trials and the patients, we have been able to land this collaboration that is a very, very cost-efficient way of us getting to the CE mark. So we are working on it with, of course, but as we speak, actually. So we are creating the data now. Once the data is there, then it's filing it.
Good. Thanks a lot, Kasper. Just one final question from me. When we talk ego innovate and partnerships, could you detail a little about what kind of agreements are we looking into? Is it a running cash flow from the partner, or is it a one-time fee? What are we looking into?
Good question. So it's certainly not a one-time fee. So typically what would happen is, first, in order to get started, the partner will be purchasing a number of devices and empty capsules for them to port their assay to the device. And once sort of they are happy with the results they get on the device, and there they are operating the device with our lab software that runs on a PC. Then once they have sort of set up and calibrated how they want the device to measure that specific assay, then we will work with them to transfer the code from and the settings from the lab software to the app that runs on the phone. And then we will also have some consulting revenue that in sort of helping them if they formulate the assay so it can get produced in capsules. Because one thing is doing capsules in a lab where you have trained lab technicians that can introduce all the chemistry. Afterwards, you need to manufacture it if you want to use it outside the lab. So then we will help with that, and then subsequently, then there will be volume production of the capsules, where there will be a royalty for the capsule production, and of course then probably also more devices, and they will need access to our software also. So there will be a software license also in order to operate the devices. So it will be an ongoing revenue stream.
Thanks a lot, Kasper. There's a final question coming in here. Okay, yeah, it's a Max about the TO3 and the probability, and then he's probably right about his assessment. There's a 50-50% chance for partnership contract. That's a good assessment, I think, to assume that. What I can mention as well is that Qlife is attending our life science seminar next week, the 31st of August. We will focus more on the pipeline, so the CRP assay, and of course the ecosystem you see behind Kasper on his wallpaper there. So with that said, I would like to first of all thank the audience for all the very good questions this time, and I would like to thank Kasper for the thoroughly run through of the Q2 and events after the Q2. And hope you all will have a very good Thursday. So with that said, thanks a lot, and thanks a lot, Kasper.
Thank you very much, Claus, and thank you to everybody who attended.